Good evening. Welcome to Health Quest. I'm Deborah Arneson, your host for the evening, and tonight we have a great show for you. We're going to be talking about Oriental medicine, acupuncture, and all the different modalities associated with Chinese herbal healing. And we have a wonderful guest tonight. This is Dr. Charlie Rojak, who is new with our clinic, actually, and she'll be joining us in a couple of months as soon as she passes or gets her certification. She's already passed all her tests. But she is just a wealth of knowledge, and Charlie has worked on me a good number of times with amazing results. So our hope is to share with you, the consumer, and our viewing audience the gift of acupuncture, which is so extraordinary, and it's probably, I'd say, one of the biggest pieces of the puzzle for most people because of the influence and the ability to move energy around in the body and to heal in a passive way. So again, thank you, Charlie, for being with us tonight.
Thanks for having me.
It's great having you here. Congratulations.
Thank you.
On your newly acquired status, Doctor of Oriental Medicine. We're going to ask some great questions of you tonight. So we'd love for you to share as much information as you can, and this goes very quickly. So I know we have a lot to cover, but let's start a little bit with the methods of treatment in Chinese medicine. What are they primarily?
Well, we use acupuncture, which is the insertion of pre-sterilized, pre-packaged stainless steel needles into the musculature of the body, into the scalp, and into the ears.
Now, the first thing people are going to ask us who are watching is like, ooh, nobody likes needles, and does it hurt? Does it?
It doesn't hurt.
No, I don't think so.
It, you know, you have nerves in the surface of your skin, and once the needle passes through that with a quick thrust, it's just, sometimes you may feel nothing, sometimes you might feel a tingling, a numbness, or a warmth, or just a dull ache that passes within 5 seconds.
Okay.
And then you just feel peace. You just feel like a free, yeah. You just feel your energy is freed up.
Isn't that wonderful?
It is.
What made you choose this field, this modality of healing people?
Well, I had guiding angels, and someone just mentioned it to me when I was younger, when I was trying to decide what to do with my future, and it just clicked, and bells went off in my head, and I was like, that's it, and I was so excited about it, and the next day I looked for schools, and I found a school here in Chicago, and I went for an interview, and I enrolled, and it's been a wonderful learning experience ever since.
And that's a 4-year curriculum, is it not?
4 years.
Wonderful. That's great. So you have a lot of experience when you get out of school, actually. You roll right into it.
Yeah, you do an internship all those 4 years.
Through the whole time. That's great. So tell us a little bit about acupuncture and moxibustion.
Well, acupuncture and moxibustion, it originated at least 2,000 years ago. Okay. That's when they started finding artifacts or documentation or classic writings on it. Acupuncture is said to have originated in the east of China. They found lots of stone needles. They actually, in the Stone Age, used stone needles.
Ouch.
Yeah.
Ouch,
and they got very skilled with making, you know, stone
very thin, sharp.
They actually found one that's about 5 inches long. They found that in the east of China. And moxibustion in the north of China is where it's said to have originated, because it's so cold up there, and people suffered so much from cold being locked into the channels of their body, so they would use moxibustion, which is the burning of an herb, which we call moxa, which its technical name is Artemis vulgaris, and it burns very warm, and when you get it, you know, you can do it directly on the skin or indirectly. In America, we don't do it directly because it causes scarring, and no Americans like to be scarred. In China, they're not so much concerned with that. Scarring moxa can actually be very beneficial for certain disorders. But in America, we use indirect moxa, where we just warm the skin and warm the needle, or stick a piece of moxa on the end of a needle.
Right, I've seen that.
Yeah. And the metal conducts the heat so well that it just goes straight into your channels, into your muscles.
Does it get hot on the body?
It does. You feel warmth, but if you're suffering from cold disorders, you're loving it. Absolutely. You're loving it.
And how often can you do the moxibustion?
Every day.
Really?
Yeah.
So I know that earlier you were giving Judy, our makeup artist, some advice about changing her energies and using the moxibustion at home. So it's
very
something
tonifying.
you could do at home on your own too, right?
Yeah.
It's not really difficult as long as someone instructs you.
Right.
Wow.
It's nice to have someone do it for you, 'cause it's nice to have someone do anything for you.
Sure, right, it is. To be baby.
But, you know, to save money and to just be able to do it whenever you want it, you can keep Moxa at home and do it on yourself.
That's wonderful.
Yeah.
So let me ask you this. Is it more beneficial for people to do acupuncture with the moxibustion?
Yeah.
It is.
It's very beneficial to do that.
Twice as potent, would you say?
Well, if you need the moxibustion, people with heat conditions who are agitated inside, whose fluids are getting cooked up inside,
Who are all like very pitta people, real
Yes.
reactive people?
you're not going to want to add heat to their fire.
Okay.
You're just not. So maybe you do a treatment with the needles, which releases heat, which helps to settle them and calm them and cool them. So you wouldn't use Moxa then. Someone with cold disorders or someone with a lot of stagnation in the musculature, stagnation, it's just the warmth helps to drive the blood and chi, which is life energy, through the body.
It's wonderful. So I have a question, of course, because we always like personalize things we learn. So let's say you know my body because you worked on it quite a few times, and I have all this kind of angst here in the shoulders and upper neck and the upper back. To do moxibustion on that area would help it even more so to like let go of that rigidity that I tend to accrue. Really?
And we'll have to do that.
Let's do that.
Yeah,
That'll
we
be
will.
fun. All right, tell me this. How does Chinese medicine envision the human body?
Well, it's like a unity between two polar opposites, yin and yang. Yin being everything that is dark and substance and cold. Yang being everything that's energetic and warm and lightness. And so you bring these two together and they balance each other. So the body is a balancing act between the yin aspects of your body and the yang aspects of your body. For instance, the energy in your body, the qi, is a yang aspect.
Okay.
The blood and the nourishing aspect of your body is a yin, is part of the yin phenomenon. They envision the body as as being channels of organized energy flowing where it's supposed to flow, and that benefits the health if it's flowing exactly how it should be flowing.
So if you get too much yin or too much yang in a different area, you have obstruction. Is that how it works?
Yeah, well, if you have too much yang, it would be too much energy, too much activation, too much heat. You're going to cook up your moistening fluids that moisten your body. You're going to agitate your body. It just works it a little too hard, and it's going to
wear out.
Yeah, you're going to have agitation. You're going to have dryness. If you have too much yin, you're going to have edema. You're going to have cold. Too much
more
substance.
sluggish.
More sluggish.
Okay. More mucus.
More mucus.
Okay.
More fat.
Got it.
And so you become very yin, very sedentary.
Interesting.
And the energy flows, which we call meridians, they unite the body. That's why the body is considered a whole. Because the energy is flowing from head to toe and from chest to arms, and it's uniting the head to the stomach. So a problem that you might have in the head may be caused by something going wrong in the stomach, or you work along the channels to clear obstruction and clear stagnation.
So, Charlie, let me ask you this. Is it a really good idea for people who think they're operating kind of okay and don't have too many problems just to come in for tune-ups?
Of course, yeah.
And
Because
how long would a whole body treatment take?
It could take anywhere from 20 minutes to an hour, depending on. We also do Tui Na massage, which is Chinese medical massage, which is very deep, penetrating, stimulating massage. And if we're going to add that and then do acupuncture, then
So you would do that first, then the acupuncture?
I like to, because a lot of people are scared of needles. So you warm the muscles up, you get them relaxed, and then you stick them with the needle, which really doesn't hurt.
Yeah,
Really.
I know, it doesn't. It's great.
It's really, I will admit that the extremities are more sensitive.
Initially, because I know the last time you worked on me and you did this little area here, when you put the needle in, it was like, wow, for
But
just a
good.
second.
That's what drives the treatment, is that extra...
But it goes away very quickly.
Oh, it does.
Now, if you twitch your muscles, you're like, whoop, don't do that.
Yeah, you don't move with needles.
Don't go moving around. Don't try and open the door and answer the telephone.
Right.
You'll be in trouble. So what substances does the body consist of?
Well, the body consists of chi, which is life energy, which we all obviously have. We're living, human, you know, moving, feeling, talking. That's why you and I got here today.
Right.
Blood, fluids, which in Chinese they call jinya fluids. Jin meaning the lighter fluids like saliva.
Okay.
Yi meaning the heavier fluids, like those that lubricate your joints. We have also the spirit is considered a substance, and because it's considered a substance, it's actually something that we treat. People who have, they call spirit Shen. Shen disturbance we can treat because we consider it an actual part of the body.
How do you know they have this disturbance? How do you assess that?
You assess it, well, a lot of the times when your heart, because the heart stores your Shen or spirit.
Okay.
If the heart, if you have heart fire, which is an actual diagnosis in Chinese medicine, you have heat aggravating the heart, aggravating the spirit. You have restlessness at night, insomnia, palpitations, irritability.
So symptomatology is associated with it. Got it.
For sure, yeah.
Okay.
And we also have essence. That's another substance.
What is that?
Essence would be your ability to regenerate and reproduce. And that is considered to be stored in the kidney. There's two types. Essence is actually something that's very interesting and very important because there's two types of essence. There's your prenatal essence and your postnatal essence. Prenatal essence is something that is given to you at the time of conception from your mother and your father. And you are only given a certain amount.
So much.
Right. You don't want to ever touch that reserve, and that way you'll stay young forever. As soon as you start tapping into that because you're not treating yourself right, and you start lowering the amount of prenatal essence that you have, that's considered the death of your body.
The beginning of the demise of all your cells.
Now luckily there's postnatal essence.
Which is built up through your childhood?
Which is built up every day of your life through nutrition.
Treating yourself right, yeah.
Through nutrition and food and your diet.
Got it.
And so if you eat well and you eat the right amount of nutrients and vitamins and minerals that you're supposed to get, and you're building postnatal essence, you'll never have, your body will always use up your postnatal essence before it uses your prenatal essence. So you'll never have to tap into your other source.
Got it.
So that's kind of how, that's the Eastern sense of how nutrition fits into health. That's why it's so important. In Eastern medicine, they definitely incorporate
diet and nutrition and healing foods. So if someone has a bout of an illness, a bout of bad luck with health for a while, if they're really sick, can they tap into that prenatal essence? And once you take it, it's gone. There's no replacing it. It's kind of like what we did when we were intrauterine. Okay.
You can always try and build up your postnatal essence, which will keep
will protect you.
Yeah,
right.
Will protect the reserve that you have left.
Okay.
But it's definitely damaging, and once the prenatal is gone, it's gone.
Now you went to study in China last year, correct?
Yeah.
How fabulous.
It was fabulous.
And you learned a lot, I'm sure, there.
Just every day. I worked in the hospital there, working with the Chinese doctors and seeing how they treat their patients. And
how fabulous.
Yeah, and also studying at the Guangzhou University in Guangzhou, China, with the Chinese professors. So it was a great experience because it's just their way of doing it.
So you picked a great deal up that you'll incorporate into your own practice.
Oh, yes.
How exciting for you.
I saw things done there that I was like, why weren't we taught this?
Sure.
This is amazing.
Sure.
It's just the American way is a little different.
Mm-hmm. Well, I think part of becoming your own practitioner and fitting into your own, you know, kind of groove is tasting and trying and seeing other modalities and incorporating those, like, you know, working with Dr. Shambu a bit and incorporating a bit of the Ayurveda, which crosses over Chinese somewhat.
It's been amazing to learn with Dr. Shambu about Ayurveda.
It's really interesting.
Yeah, and how the Eastern medicine correlates with the with Ayurveda.
It's very
nice.
It's very close. So tell me this: what are the functions of the major organ energies in the body?
Well, in the body, we consider that we have our yin and our yang organs.
Okay.
I'm going to discuss the yin organs, which are the very heavy, substantial organs.
Okay.
The yang organs would be your bowels and your stomach and whatnot.
Okay.
I'm going to discuss the more internal organs, like your spleen, liver, lung, heart, and kidney.
Okay.
They're very important, and they have very specific functions in Eastern medicine. The liver is responsible for the free coursing of energy throughout the body, meaning that it's supposed to encourage the qi and blood of your body to travel smoothly and evenly throughout your fingertips, through your head, to nourish every part of your body throughout your legs. And if this is not occurring, you're going to have moodiness, anger, you're going to have tension, all those things.
Just more fragile.
Well, you won't be resilient. And this is where I like to compare it to a tree. Like we're a tree, and the tree takes the moisture from the earth up through its roots and up to every leaf. And that way, when the wind blows, or
there's a storm,
you can be resilient to everything that happens in your life.
Sure.
So even, your boyfriend breaks up with you, you're resilient. You can bend with it and then go back into position. This is the liver. It keeps you if someone has a lot of liver qi stagnation, is what we call it, depression, you just can't handle things the way, optimally.
That means their liver is somewhat compromised.
Right.
Okay.
And this is the liver energy that I'm speaking of.
Okay.
Because in the Western sense, we always talk about it as doing, detoxing the body and always, but I'm talking about the actual liver energy, what its function is throughout the entire body.
And you have different meridians in the body, in the systems, in the organs that you would target that would help the liver to perform better. And same with the kidneys then.
Right.
Cool.
And speaking of kidneys are very important too. Kidneys store the essence, like I was speaking of. So be good to your kidneys, because kidneys
aren't.
Kidneys are responsible for reproduction, regeneration. They rule the bones. So you see deformation in children, and they're not developing well. The kidneys are responsible for development. This is all because the kidneys are not strong. And this is maybe something that they inherited from the parents, because the parents' kidney energy weren't strong.
Okay.
The kidneys, they also monitor water fluid regulation,
well, they regulate our blood pressure as well, and electrolytes. So we're talking homeostasis and balance in the body, right?
Yeah.
And it's a major detox pathway. And think of all the toxins that we throw into our kidneys every day. It's amazing.
Yeah.
How many cups of coffee do you guys drink? It's a lot for most Americans, or Cokes, or Diet Cokes.
And the kidneys are housed, and they're said that their mansion is in the lower back, which is true. That's where they're located. So when you have kidney weakness, you have a lot of lower back pain, which is associated with your knees. You get a lot of knee pain. So you really want to keep the lower back strong and healthy, because then you'll also benefit the kidneys.
Wow.
We also have the spleen. Now the spleen is very important also. I know some people may not think so and may remove it, but the spleen is responsible for the transformation and transportation of your food and fluids.
You were saying that earlier.
Yeah. So this means that because of the spleen, you're building blood. If you're building blood, you're building nerves, you're building flesh, you're building muscle tone, you're building bones, it's very important to keep your
Well, I know
spleen
you
intact.
had, you know, Judy stick her tongue out before, and it was kind of like poochy and ridgy on the sides.
Scalloped.
And that meant that she has spleen deficiency.
Right, spleen qi deficiency.
Which is interesting, because some days I feel like my tongue is too big for my mouth, and I'm sure it's after I eat peanuts or something I probably shouldn't be eating, but it feels like my tongue is too big, which would mean that my spleen is having a bad day, or that I have an allergy.
Maybe it's an
That you shouldn't
allergic
eat peanuts.
reaction.
Yeah, interesting.
But if a person has a scalloped tongue, which is like a swollen tongue, and then it has ridges in it because of the teeth, because the tongue's pressing against the teeth, this does indicate that there's excess fluid in the body, which manifests in the tongue, swelling the tongue, pushing it against the teeth. So it does indicate that your water metabolism is
off.
a little off, right?
Okay.
And the spleen's also responsible for containment. It contains the blood within your vessels. It contains your uterus in its spot, your colon in its spot. So you get a lot of if your spleen is weak, you get a lot of prolapse.
Really?
Everywhere. Women don't like that. That
No.
you start to sag.
Not good.
That's not good. That's why you're good. You have to be good to your spleen. And the way that you're good to your spleen is you don't eat cold raw foods. You don't eat ice cream. You don't eat lots of sugar. You don't have a lot of alcohol. These are very damaging to the spleen, because the spleen has to, it kind of sees the food. You can imagine it seeing the food coming down and being like,
Oh, no.
you want me to do what? You know, and sometimes the spleen will just, if it's weak enough, it'll say, you know what?
I'm outta here.
Forget it. Turn its back on you, and you're going to end up with loose stools and diarrhea.
That's what that is an indicator of.
Weak spleen,
Really?
because it's
Huh.
and
I
yeah,
didn't know that.
right.
Jeez.
Or you'll just be distended, and you'll have
Bloated.
lots of gas, and this is also spleen qi deficiency.
Now, if someone has like a weak spleen and they came to you, how many sessions do you think someone would, you know, need to go through on an average? Does it depend if they've had it all their life, or if it's just something they've created because they drank too much in college? So it varies person to person.
It does. It varies for sure.
Some people react really well if they're treating their bodies really well, I'm sure.
It depends on the duration of how long you've been experiencing this. If someone's healthy and they just, you know, they, for whatever reason, they're having diarrhea and whatnot, and you give them some treatments, they will respond very well to it. If someone has been suffering for years and years and years, and they're so, you know, you can just tell when someone is spleen qi deficient, because they look so
drawn.
Yes.
Well, like a lot of
drawn.
vegans, this is my next question. A lot, you know, you look at people who eat only raw, which is becoming like a craze right now. And you see them, and their skin is hanging, and they have that sallow kind of complexion.
And they look blood deficient.
Yes.
Somewhat pale and somewhat undernourished.
Right.
Like I said, the spleen is responsible for building blood, and with the cold foods, you're kind of wearing out your spleen. And when you wear out your spleen, you're not building blood. And when you're not building blood, you're not nourishing your body correctly.
Right.
So what you're going to get is some areas of it, you might get headaches because you don't have enough nourishment in your head.
And you will diagnose this. We're running out of time, believe it or not.
Oh my gosh.
Yeah, I know, it goes really fast. So I'm going to ask some really pointed questions. Let's go to, how does Chinese medicine treat disharmonies in the body?
Well,
keep it short, Charlie.
Okay, we treat by using the environmental factors. If you have cold trapped within, we use heat to warm it up and cure the cold ailment. If you have a heat condition, we cool you down.
Got it.
If you have a damp condition, we drain the damp and dry you up so that you don't feel so heavy and your limbs don't feel so heavy. Right.
Yeah.
If you have a dry condition, we moisten you.
So you use a combination
balancing.
of herbs and acupuncture and moxibustion to do this. Okay. Now the next question is, why is it important for people to talk to a qualified practitioner who's familiar with Chinese herbs before they start to use Chinese herbs on their own?
Because everyone has a very personalized condition. Nobody is the same, and just because Ma Huang might be good for some people, like you hear a lot about Ma Huang harming people, it might be so damaging for someone who it's totally contraindicated for, but they think, oh, it's good for you, it speeds you up. It's very important because you shouldn't self-medicate, and you could, if you have a heat condition and you're taking very hot herbs,
It'll make it worse.
It'll just worsen you. You'll be like, oh my God, this is terrible. Chinese herbs are terrible.
Right.
But it's actually, if you took the right herb, you'd be loving it.
Mm-hmm.
You would be cured.
You'd feel great.
Yes.
Yeah, that's one of the, I have just a high respect for herbs.
Mm-hmm.
You know,
Me
I'm very
too.
cautious with them. I tend not to use them a lot in my practice because I don't know enough about them.
Mm-hmm.
So I'll just refer everybody to you,
Okay,
Charlie,
great.
okay? How do the functions of Chinese herbs differ from Western drugs?
Chinese herbs are very supportive. They are very supportive to the system, and they help to counterbalance whatever imbalance you have. So they're treating the underlying problem of why you feel the way you feel, not just the symptoms, the underlying problem.
Mm-hmm.
So that your symptoms, not only, you know, will one symptom clear up, the whole line of
Get it.
symptoms that go together, the pathology will clear up.
Especially if you find the primary cause,
Exactly.
right?
Right. And
Okay.
with Western drugs, you find more that you're treating more symptoms.
Mm-hmm. Band-Aid on the boo-boo.
Mhm.
That's the approach with
Right.
Western. So we've got just a few minutes, so I'm sorry this is going so fast, but what causes disease in the body and how does acupuncture help that?
Well, disease in the body, the health in the body is, a healthy state in the body is when qi and blood and moisture, mainly qi and blood, are moving smoothly and perfectly throughout the body. You're like a river of energy flowing, detoxing, nourishing. If you have any deficiencies or excesses stagnating your energy, things become stuck. And this is what causes disease, when you have stagnation in your channels.
Right.
First it starts with a way of pain, and then there's not enough energy nourishing one part of your body, and the obstructed energy, it's like a river. If a river's flowing and some trees fall into it, and then gook starts to collect around the trees, you're blocking off the river, then the river's going to have to relocate, which is not good in the body, because they have very specific energy flows.
Right. So the acupuncture then will help you change the way that energy moves. Now, when someone does acupuncture or does one treatment, how long do the benefits of that treatment generally last? Let's say if they're, you know, say it's myself and I eat pretty darn good and don't abuse myself and exercise.
They
week
could
or so?
last forever. If it's a very chronic problem, you might have to, you know, if it's a chronic problem, you come back, you come 2-3 times a week.
Okay.
And it starts to slowly clear up. And as you experience it less, you'll need less acupuncture. If you never experience it again, wonderful.
That's great.
Yeah.
Well, I know that I've had amazing results with you. It's been wonderful. Charlie, we're out of
Thank
time,
you.
believe it or not. It
I
goes
can't
so
believe
fast.
it.
Thank you for being here
Thank you for
tonight.
having me.
And if you'd like more information on Charlie, our Doctor of Oriental Medicine over at Healing Quest Center, give us a jingle and we'll be happy to give you more information. And until I see you next week, please take good care of your health. I'm Deborah Arneson bringing you Health Quest. Good night. That was great. Good evening and welcome to Health Quest. I'm Deborah Arneson, your host for tonight, and we have with us once again the infamous Dr. Shambhu, who's visiting us from Kerala, India, talking about Panchakarma and Ayurvedic healing. So we're very grateful to have him. He's 16,000 miles from home, and a huge blessing to me to have him over at our small center and doing the amazing work that he's been doing on people. So our goal is to share with as many people as possible the wonderful news that there's always hope for healing, and the gift that Panchakarma has, actually been given to us through Dr. Shambhu by bringing him to Chicago. So thank you for being here again, Dr. Shambhu.
Thank you, Deborah, for inviting me here.
It's great having you back once again.
Yeah.
Listen, we're going to talk about Ayurveda, but first, before we go into the details of Panchakarma and Ayurveda, tell our viewing audience, in your opinion, how does Ayurvedic healing differ from allopathic medicine?
Well, the main difference is in Ayurvedic medicine, we consider the body as a whole unit. So instead of treating the symptoms, we detoxify the whole body, which both have a physical and a psychological effect. In another word, we call it, we clean the body on the physical level, also on emotional level. So this got a profound impact on the system. So the main difference is it's not a symptomatic treatment, and the treatment lasts for a long time, and the person who received the treatment will go for a passive shift in their life without any instructions. They start to eat the right food, the right habits, right behavior. It all automatically follows.
That's wonderful.
Instead of following an instruction.
So it's a passive way of receiving healing and balancing.
Yeah. And they don't feel, because the body have a, what you call a rebelling tendency. If you give an instruction, they want to sabotage it.
Right.
So here we have a different procedure after finding the body type and everything, which we explain later. So it's a very passive, natural approach. Body don't find it invasive. So body don't show any, side effects or anything.
Right. Well, we'll talk about Panchakarma, which is heaven, actually. It's so funny because it's like once you smell the oils and the herbs involved in the healing process, it's like when you smell them, you're like, like a puppy dog coming to a biscuit. It's just fabulous.
Yeah, I mean, the smells of the oils are very different. When I first started treatment in Europe, first I went to Milan, and when I did the treatment, I mean, definitely the smells are different from the Western smell, and they don't want to put on oil on the body. But immediately in 2 days' time, nobody even wanted to wash the oils off because they said they felt so good, so protected. So the oils actually work with the body in order to detoxify the system.
Right.
So the analogy is like putting a cloth in a soap water.
Right.
The oils are cooked in a specific way. It penetrates your system, combined with your toxins. Then we have some specific movements and other things to direct these toxins to the natural excretory sites.
So this is Panchakarma.
That's Panchakarma, yeah.
Okay. What are the basic principles that precede Panchakarma in the Ayurvedic healing modality?
Well, the basic principle in Ayurveda we call the Tridosha theory. Three means three, and dosha means these are three energies, and these energies can be easily spoiled. Dosha means something easily spoiled. So three energies we call the Vata, Pitta and Kapha, and every person get these energies at the moment of the conception of the sperm and ova of your father and mother, and that is determined by how is your father, how is your mother, the socio-economic situation, the psychological makeup of the parents. So you get that structure at the moment. And how we can see the energies, I mean these are three energies actually, we can see the energy by looking at the body because each energies produce a certain physical characters.
Okay.
For example, how they look, the hair, the eye, the kind of energy they're generating out, the way they walk, the way they speak. So we look at everything. Then we can classify the people into three categories.
So what are the three energies?
Well, the first energy we call the Vata.
Vata?
Yeah, this is normally, this energy control all your intellectual functions. The second energy we call Pitta, which control all your energy production. And third we call the Kapha, which is your infrastructure. So to speak in a simple terms, in a single cell of your body, the intelligence of the cell is given by the Vata. The energy production, say metabolism, is controlled by the Pitta. And of course you need some material to hold the intelligence and the energy. This is given by the Kapha. And we call in a balanced individual, these Vata, Pitta and Kapha should stay 1:1:1 balance. This is an ideal system. So this person is always balanced in any situation.
Are they born balanced then, or do they obtain that through the treatments?
Some people are born balanced, which is possible. It depends on accidentally or the parents are following very good diet and routines and they're free from stress levels. So it's possible. But the balancing is once a person understands the body type, like we tell them, okay, you belong to this category, and there are some specific procedure, a daily routine, simple thing they can follow in their daily life to balance it. So they know that they belong to that category, they to do something
to stay in balance.
Balance, yeah, because they tend to go to the original situation.
Well, I know that I'll do a dosha questionnaire on all the new clients that come into my office, and occasionally I'll see people who have a very nice split ratio of Vata, Pitta, Kapha.
Yeah.
So they're not too far off center then, right?
No, not too much, but there is a problem in these questionnaires. You know, most of the Ayurvedic books, they have the questionnaires now, and people fill up these questionnaires and they think it's something different there. So I tell the people, I mean, this is your genetic constitution. One is your genetic constitution. So it can be, you know, what we call a Vata dominant or Pitta dominant or Kapha dominant.
Right.
Of course, the Vata, Pitta and Kapha always stays together. You can't split it.
Right.
When we say Vata means Vata is dominant, and the other two doshas or energies are less and least.
Right.
So
we all have all the energies.
All the
Nobody has just one. You just have a dominant and a secondary and then a tertiary.
Yeah.
Okay.
And the second is, you can be in a phase. For example,
having a bad phase. What does that mean?
Coming to you, you got a Kapha dominance, Kapha structure.
Okay.
So you have more a soft approach and soft nature and everything. Suppose you are not having enough sleep, you are flying, changing different time zones, food is not good. You automatically come to a Vata phase. You behave like a Vata person, which means that you become more irritable, your sleep is less, you become hypersensitive, hypervigilant, you develop constipation. So that is a Vata phase. You're not a Vata type. Due to circumstances, you're in a Vata phase. So if you take a rest or something, you come back to the
your original
thing.
Okay.
So if you're in a Vata phase and then you look at this questionnaire and then you start to fill it up, so you start to tick what is happening now, which may not be right.
Got it.
So we look, diagnosis, that's the main thing.
So how do you diagnose people?
It's in 4 levels. First, of course, we look at the body types, because Vata, Pitta and Kapha, I told you, produce certain characters.
Okay.
Simple things, you know, Vata people are very thin people. I mean, in that area, for example, when we talk about Chicago, thin people on the Chicago standards. And the medium people are more Pitta type, more athletic looking, more active type. Kapha people are more contoured, you can't see any bones or anything. More, you know, rounded structure.
That's a nice way to put it. We're more contoured.
Yeah. So, well, they can get obese from that point.
Watch it. Yeah. Okay.
So, so we look at that thing. So, first is the physical thing. Second is we want to know where they live, because we classify the land into Vata, Pitta and Kapha. For example, a city, you know, is an active place. We call a Pitta place. So, if somebody lives on a city, it's a place of stimulation, so eventually it drains a person out. So they feel depleted at the end. Somebody lives on a countryside, it's a quiet place, but it produces stagnation on the mind and body. Somebody lives on the suburbs, it produces, they see the possibilities of a city, advantages there, they see the quietness of the countryside, and they are in the middle, so it produces an ambivalence in the system. So each place where you live, for example, if you live more than 6 months or 1 year in either of these places, you acquire the characters of the place.
Interesting.
For example, a Pitta person living in a city will be more Pitta, which means that they become hyperactive.
Crazy.
With a little provocation, they become violent.
Yes.
I mean, physically or verbally.
Yeah.
A Kapha person, which is a quiet person, living in a countryside, may feel more stagnated.
So a Kapha person living in the city would probably do well, because it would keep them a little more active.
Yeah.
Whereas a Pitta person living in the country would do better because it would calm them down a little bit. Okay.
Right.
Where should a Vata person live?
Well, Vata person definitely looking for, so it's better to have a commuting. Well, the best thing is to have a Vata person to go for a quiet place.
Okay.
But the problem with the Vata and Pitta people is they are always looking for a stimulation or change. Vata people want to change always. They change the job. I mean, talking about the abnormal or negative Vata types. Change the job, the places, relationship, everything they want to change. Pitta people are looking for stimulation or drive, or challenging or confrontation. You can call it on any level. Kapha people want to be more quiet and introvert and don't disturb me, leave me alone. Type of. So anyway, we look where they live because it affects their characters.
Okay, so we look at their
First the body type, second where they live.
Their living environment.
Yeah, the third is we have age group because we have 3 age groups from 1 to 16. 16-year-old is like it's a growing period. We call it Kapha period.
Okay.
And at that time they have more Kapha diseases. So if a Kapha type person on the Kapha period have more problems.
Okay.
From 16 to 60 is a middle age, so it's a more fiery period. You know, it's an active phase of life.
16 to 60.
60, yeah.
Wow.
It can be even up.
Okay.
You know, depends on the type.
That's Pitta.
Yeah, Pitta type. And above 60 is a Vata type people, or Vata will comes in. So, you know, it's aging and other problems of aging.
Okay.
The last is we have a pulse diagnosis.
Okay.
Well, it's actually in Sanskrit we call the Nadi.
Nadi?
Nadi is the actual term. It's called Nadi Pariksha. Pariksha means examination. So, what we do is we are not counting the heartbeat. So normally we take the radial artery and we visualize the artery as a tube. And suppose this is an artery.
Right.
And I put 3 fingers on the top of the artery.
Vata, Pitta, Kapha?
Yeah, the index fingers represent the Vata, the middle finger is a Pitta, and the ring finger is a Kapha.
Okay.
So normally we take around, say, 1 to 1.5 inch from the base here, and we put the 3 fingers on the artery.
Okay.
And then we have to know on which finger you get the beat.
The strongest pulse.
Strongest pulse. So suppose if you are a Vata type, if you are a Vata face, if your mind is thinking you are a little bit irritated or anything, we get a Vata beat. If you are
I'm not irritated, but I'm Vata.
It's like if you are
I'm thinking right now.
Yeah, yeah. It's like a mental activity. You know, there are different ways of explaining it. If you are very active, energetic, so we call it you're on a Pitta phase. If you're quiet, relaxed, lethargic, you know, everything come to that balance level, we call it a Kapha place.
So you could actually, on a great day, have a completely balanced Vata, Pitta, Kapha pulse, right?
Normally, we have to check the pulse in the early morning.
Okay.
So we don't have that possibility because
First thing
people
in the morning?
come. Yeah.
Okay.
So the pulse will tell you the exact situation. So for example, in treatment, when people come to me as for the diagnosis, when I check the pulse, if it's high, for example, I have to detect. Sometimes Vata is very high. So I ask him, you're driving or is it bad traffic or you're walking or running.
Right.
So I have to detect all that influences.
Got it.
Then I have to calm down.
Okay.
So actually we check the pulse to see what's happening inside. For example, when we look at a person, you know, the system can mimic. A person look very quiet. Everybody develop a mask in order to survive in a particular society. It's automatic. It comes there. So a person look very quiet and serene in the face. It doesn't mean that inside is quiet.
Right, right.
So
Still
we have
waters
to check
run
the
deep.
pulse. Yeah. So the pulse will exactly tell you what's happening inside.
Well, if I could just interject something, the most amazing thing about this, the pulse diagnosis in Ayurveda, is that it is always right on the money, completely accurate. I mean, there's no guesswork with it.
Yeah.
And if you take someone's pulse and you say, you know, is something aggravating you right now? Are you having a disturbance at home or whatever? Because their pulse is indicating it. Absolutely, that's the truth. That's what's going on.
Yeah.
So you know they're in a phase. Okay.
Yeah. Actually, pulse will give you also your status of your organs, your function of the body, internal organs.
What does the Vata represent? The mind?
Yeah, all the nervous system.
Okay,
But
the
we
nervous
classify
system.
the Vata into 5 divisions,
Oh, really?
Pitta into 5 divisions, and Kapha into 5 divisions. To speak simply, for example, coming to heart or liver, the Vata indicates a nervous connection to the heart. Pitta indicates the energy production, the metabolism in the cardiac muscles. Kapha indicates the structure of the muscles,
Got it.
the quality of the muscle.
Strength.
So every organ got these 3 energies there. So we can see how it operates.
Interesting.
And it's divided into 2 levels. Normally for females we check on the left side because we call it left side is a feminine side, and the right is a masculine side.
Okay.
So checking normally for the female we check the left side and male on the right side. But we also check both sides. For example, coming to you, I check the left side to see what's happening to inside your body. This gives you a metabolism. Internal, what's happening in your organs and everything. We also check the right side. So the right side is a masculine side, and you are a concentrated female energy. You know, outside is a masculine. I mean, that's a concept. So checking your right side gives the information. How is your relationship with the outside? To say more specifically, if your right side, I'm having a Vata pulse, this means that you don't trust you outside. You don't trust the society.
I'm Kapha Pitta.
Yeah, which means that Pitta means you trust the society. I'm talking a macro level. It can be macro and micro. And Kapha means you're kind of detaching from the society, or you're kind of fed up with the society. So, I mean, we check with these things in order to see from where the problems are coming from. There can be stress can come from outside, accumulate into the body, and show us a problem, you know. So, if the problems are from outside, then what we do is we do some Kapha balancing procedures, because Kapha, as I told you, is like your infrastructure. It's like an armor around you. It's like it's eroded, or there's holes in it.
So let's say, for instance, I take my pulse on the left side and I'm very Vata. Would that indicate that more of my energy is concentrated in this area and the rest is shut down?
No. On the left side, if I get a Vata, means first of all, this is an indication that your metabolism is erratic. Sometimes you are very high, sometimes you are very low. Some, you know, like you work to the point of exhaustion, then you collapse.
Crash.
So it's kind of an up and down graph. Second thing is you have a possible, I mean, there's a constipation there. Skin is dry.
I'm fine.
Okay.
Thanks for asking.
Yeah. And mentally, you are more sensitive to hypersensitive. You're getting very irritable. Mind is running very fast. I mean, you are not reaching to some conclusions.
So, for instance, if I find I'm really Vata right now because I'm really concentrating on what you're saying and you know what's going on, then when I leave here, if it comes back down to more Pitta Kapha, that means that I'm just into a Vata phase because I'm thinking a lot or concentrating.
You're doing a work here.
Interesting.
Also, Vata indicates more of a joint problem. Like if person have any problem in the joints or arthritic or rheumatic complaints. You know, there's a problem with the mobility.
So could you digress just for a moment and tell our viewing audience about the feel of the pulse? Like the Vata pulse is...
Well, it's like we have a... What we do is, I told you, we visualize artery as a tube. And we put the finger on the top. First information is, I mean, we have to know from where you get the beat. The second is, we have to know how the blood is moving inside that. I told you, we are not counting the heartbeat here. So in the Vata beat means it's like the movement of a snake. And so, I mean, it's everybody can develop it after checking. Put the finger and see how the blood is moving. Just visualize artery as a tube and you can see that. If this move like a movement of a snake means
Vata.
Metabolism is erratic and they're constantly changing. And in a Pitta state, it's like a high metabolism. It's like they're burning out, you know. So it's like an upward jumping of a frog. So you get a strong beat on the middle finger.
Like a big pulse,
Yeah, which means that it's like a car on a neutral gear. Instead of idling, it's accelerating.
Got it.
So a Pitta person, for example, you're a Pitta type, suppose, and I'm checking your pulse. Your pulse is like you're walking.
Yeah, it's like boing to boing to boing.
Yeah, very fast. And they're constantly burning. It's like the abnormal Pitta means it's like a military on the border, constantly on a high alert situation. It means they're burning down.
High alert, not good.
No, that's not good, So with a little provocation, they react in an exaggerated fashion. Coming to the Kapha type, pulse is like a very walking of a duck or an elephant. This is they use very slow. Which means that the metabolism is slow. So again, we look at the other factors, the type and many other things to see that.
So when somebody's starving, I'm sorry, didn't mean to interrupt you, but when somebody's starving, for instance, would they go into a Kapha phase or do they have to be totally anorexic? Because sometimes when people are really hungry, they become really Vata as well.
When somebody is starving, I mean, or actively starving or passively, no, either way, it's a Vata state.
It is.
Yeah.
And only when the body shuts down does it become kapha?
Yeah.
Okay.
Yeah.
All right.
It's an anorexic state is a vata state.
So let's go on to panchakarma real quick.
Yeah.
How do you balance the doshas for a normal person?
Well, once we find out if it's a vata type person, vata people are constantly moving and looking for a stimulus, moving. They want to change all the time. For example, in an office, when you look, the vata person constantly get from the chair and walking around and coming back. They can't sit in one point. So if you find it's a vata person, the simple procedure is we tell them, of course, they need more of a calming procedures. So they can meditate some, they can hear some soft music. We tell them after 7 o'clock or 8 o'clock in the evening, don't take any stimulants. They have to reduce the stimulants. We tell them to apply the oil on the body, take massages, which also produce sort of an insulation on their system, so they're not going to be stimulated by the outside triggers. So, and they have to stay in a warm environment, take warm foods, easily digestible food, nothing cold.
And vatas love salads.
Vatas love salads.
They love cold food. It's amazing.
And it makes them more vata.
Got it.
Yeah. So they have to take cooked foods and kind of sweet, salt, and sour food in a moderate basis.
Okay.
And they have to, don't expose to cold winds and while driving, wind is blowing on the face. This is also no good.
Okay.
So these are the general procedures. And then we tell them to put oil on the body, like a plain sesame seed oil on the body every evening. Just apply all over the body, then take a warm shower. It's enough for a vata to calm down a vata person.
What about a pitta person?
Pitta people are kind of quite active type. They're looking for confrontation. So they have to know that with a little stimulation or provocation, they just want to go for an action. So this is a pattern in them. So they have to know that first. So if there is a provocating situations, they have to actively move out of it. That's one thing. Second is in a pitta state, they crave a lot of sweet sugar. Sweet. Because they're burning out and the system look for something, it's a glucose for the fuel. At that point, they crave for chocolates. So if they take chocolate, refined sugar, it's like putting petrol into fire, they burn even more. So a pitta person have to take a lot of salads, which means they have to take a low-calorie, high-fiber diet. So they're not going to burn more. And it's like your fire, you put a wet wood into it. So they have to take more salads, more sweet fruits, because they still need sweet. But instead of a fast-burning sugar, they can go for fruit sugar, which is slow-burning. Just to cater their mind, they can have a piece of chocolate or something, because we have to cater that. Otherwise, they'll go for it.
And then kappas?
Kapha people need more stimulation, so it's better that they go for more outing things, like with the friends who are more extrovert, go to the places, stimulating situation, wear more warm colors, hear fast music. The food can be more spicy food. More strong massages on the body.
Type actions.
More outgoing things, which is good for them. Otherwise, they stagnate and they gain weight. And they worry about their figure. Like kind of a very,
I know. Kapha being I am. So we have only 5 more minutes. I know it goes really fast. So let's follow up with panchakarma. The healing modality, which I absolutely am the biggest fan of, because it's created huge changes in my life. And you again have been using this on so many of our clients over at Healing Quest Center with amazing results. So tell our viewing audience about panchakarma. What is it? Why would they do it, and what can they expect as far as results?
Well, in treatment, we follow 3 procedures. First is if you find a person, we tell them, okay, you follow a daily routine, like something in diet and what time they have to wake up and things like that, some common sense things. And second is, if it's not working, we tell them, okay, go for the medicines. We give them herbal medicines. But in most of the cases, everybody already developed a pattern in their thing. They constantly sabotage their system because nobody is stupid. Everybody know that, okay, what good food, what is bad food, but why people constantly eat junk food. Okay, they have many excuses, like, they have no time, this and that. But beyond that point, there's a pattern in their system. They're constantly sabotaging themselves.
Their life, right, their
life.
bodies.
So they constantly repeat the same thing over and over again, even if they know that is bad. So Panchakarma is to unwind the whole procedure, the whole pattern, same. So here what we do is, we are actively intervene into the system. I mean, what we do is we start the massages, kind of oleation with the with the oils, and the oils go into the system by osmosis, very specific oils. Disintegrate the toxins. Toxins can be anything, can be metabolic waste or environmental toxins. So the peripheral toxin pass through your sweat and urine. The deep toxin can be heavy metals and other things start to come to the lower part of the intestine. To remove that, we use an implant of oil. So we call Vasti. So for communication, I can use the word enema, but here we are not using the enema for constipation or anything.
Right. Just to pull toxins out of the lower
Yeah, so we
colon.
give an oil infusion
Okay.
to the rectum. So the oil will stay there. These people can go for work and everything. You know, I have people here in Chicago, they are lawyers working in the trade floors, in the stockbrokers. So they have oil in the stomach and they go for working. The court. So it stays there. They don't feel anything.
Right.
It don't come out. And it stays there and it absorbs the toxins. Because these toxins are organic in nature. It's a fat-based thing. We need a fat solvent. Water can't do that. So we need oils. It's like cleaning grease with petrol, you know.
Right.
So it stays there, it absorbs the toxins. And it comes out after 2 hours or 5 hours. And it's not an explosion or anything. It comes out very slowly.
Okay.
And when it comes out, only the oil will come out. So we are not at all talking
the
about constipation. Yeah. Yeah.
Okay.
So this we do, and this is we call the removal of the physical toxins. Then we go for the removal of the emotional toxins. So at that part, what we do is after the massage and everything, we cover the body, cover the eyes. We have oil falling on the third eye.
Have you ever met anybody who doesn't have emotional toxins? Just kidding. Okay, we've only
Everybody
got 1
has.
minute here, so-
So what we do is when the oil fall here, it produces a deep alpha state in your brain,
Right.
and they start to passively release all that emotional stuff.
I know. It works.
So, and it is passive, and we call it an emotional garbage. We don't want to know from where it's coming from, how it came from. It just can go out.
Because in Ayurveda, there's the firm knowledge that we know the physical body and the psychological and the emotional are all tied in together. They are not separate.
Yeah.
So you have to release the emotional angst, and the spiritual then becomes lighter.
Yeah, because as long as these emotions are there, we call it when you see or hear something, you go back to your archives and hook to these emotions, then you repeat the same thing over and over again.
Which we don't want to do.
Yeah, so we flush out these emotions, so then they immediately, we call it, we
Feel
make
better.
the past neutral to make the future neutral. So they're not going to be hooked by these emotions.
Well, thank you, Dr. Shambhu. This was great. It goes so fast when we have you. So if you'd like more information on Panchakarma and Ayurvedic healing and or Dr. Shambhu, you're welcome to give us a call and we'll be happy to answer whatever questions you have. But in the meanwhile, start doing Panchakarma on yourself at home. We'll send you some information on that as well. And until we see you again, I'm Deborah Arneson bringing you Health Quest. Take good care of your health till next week. Good night.
you.
Thank you for being here.